The expansion of AIIMS network in various states is to bridge the regional imbalance in healthcare, increasing medical college and upgradation of super specialty hospital. In today's conversation, we have with us Dr. Nitin M Nagarkar, Director AIIMS Raipur, who will be giving us insights about how AIIMS Raipur, established by the Ministry of Health and Family Welfare under the Pradhan Mantri Swasthya Suraksha Yojna in 2012, is managing to win people's trust and build its reputation among the medical fraternity. Thanks for joining with us, Dr. Nitin, for taking out your time. To begin with, I would like to ask, how is AIIMS Raipur making a difference or playing a significant role when it comes to the scenario? Because as a state, Chhattisgarh has been dubbed as one of India's poorest states with a large tribal population. Over to you, sir.
Thank you, madam. Thank you very much for inviting me for this wonderful interview. And yes, AIIMS Raipur was amongst the first 6 of the new AIIMS, which were established in 2012. Before that, we had only one AIIMS, that is AIIMS New Delhi, which was established way back in 1956. And after that, other new AIIMS have also started functioning. So we now have a total of 22 plus one old, that is the AIIMS New Delhi. And yes, the entire purpose of establishing these new AIIMS in relatively far-flung areas was so that this high-quality teaching, medical education, and of course, research and patient care would be available to larger populations in our country. And I think that mandate is very well being achieved in our institution over here. We, being centrally located, that is in the state of Chhattisgarh, get patients from UP, MP, Jharkhand, Odisha, Maharashtra, all the neighboring states, of course, apart from the state of Chhattisgarh. And it has been a game changer, no doubt, for the healthcare sector and the healthcare scenario here. It has become, in fact, a medical hub, attracting patients from different parts of the country already. And yes, the state is a new state, but a young, dynamic state. It has a large tribal population in far-flung areas. So it is a state which has, of course, a large tribal population situated in far-flung areas. But at the same time, it is rich in natural resources, and it has a rich culture and heritage. And it's a very rapidly dynamic and vibrant state. So I think, and plus the government sector, whether it's the state government, central government, as well as the private sector, has grown fast, and it's become a medical hub for this part of central India. AIIMS Raipur is certainly playing a very big role in that. But our important mandate, apart from patient care, is teaching and research. And we would always like to focus on that.
Okay, teaching and research is really important and one of the main criteria for establishing AIIMS. So to continue with, I would like to also ask, sir, AIIMS Raipur must be tackling patients from the entire state, and as you said, from the other states, which because you're centrally located. So can you tell us about the patient inflow in AIIMS Raipur?
Yeah, so if I'll tell about the daily OPD visits, because say from around 2,800 to 3,000 patients a day, usually from Monday to Friday. On Saturday, because it's otherwise a half day, almost 1,500 to 2,000 patients every Saturday, around that figure. So these patients, of course, we would like to cater to the high-end cases, mainly referral cases, although AIIMS becomes such a big brand that everybody wants to come to AIIMS. But we have a screening OPD for that, so that patients of routine ailments can be tackled over there. And those needing specialist care are therefore referred further on. But there are a large number of referrals also. So we get a mix of both. We have online registration as well as, the walk-in OPD registration, because in our country, we have patients who come from diverse backgrounds. But more and more patients are getting the online registration benefit. And that's how we see our patients here.
AIIMS Raipur is tackling or helping in healthcare interventions, like in supporting the already overburdened health systems and working towards the betterment of the healthcare sector in the state. And what is the current bed capacity and what is the progress you are making in the state?
Right. So I'll talk with the bed capacity. We have a 960 bed capacity, and it's almost usually around 80% full. There's a huge pressure because large number of patients coming to the OPD as well as in the trauma and emergency. And they do, of course, require admissions. Many patients are also getting the benefit of the Ayushman Bharat scheme. So again, it's very attractive for especially the poor patients or those who cannot afford. And we definitely work together with the other stakeholders in our state, especially with the state government. And we already have telemedicine and referral patterns set up from the periphery, and a hub and spoke model for whether it is kidney patients or pediatrics, cancer patients, and so on and so forth. So we are already partnering with them. Their teaching, training, and referral pattern, we always help them out in that. And I think over a period of time, it will evolve further and become a good model for other institutions also.
Like the pandemic has definitely ushered us in an unprecedented digital health ecosystem. Everybody has switched to more into digitalization because of the pandemic. So what are the various digital initiatives AIIMS Raipur has taken? And I think you had PM Vani Wi-Fi service, which was recently launched.
Yes.
So yeah,
Thank you.
similar ones.
We do have the PM Vani Wi-Fi service installed in our institution, and it is functional. We are very happy that these kind of initiatives of the government making this kind of a system or ecosystem developing in our country. We were already having telemedicine facilities in our institution before the pandemic also, and many patients from far-flung areas, with the help of the paramilitary or the state government, we were running a successful telemedicine project. And then because ours was an important hospital during COVID times, we were managing COVID as well as non-COVID. And AIIMS Raipur played a very important role during those tough testing times, I would say. And telemedicine was also utilized, especially for the follow-up of the patients. We had our physical OPDs only shut off for a very short period, especially during the lockdown, but otherwise, most of the time our hospital was made functional and open so that patients, COVID, non-COVID and trauma emergency would all get the benefit. And as per requirement, even a large number, about almost 50% of our beds during the peak time, especially the second wave, we had to even keep for COVID, earmarked for COVID, and they were utilized accordingly, almost 500 beds. But then as required, it was scaled up and down as per the need. And we are using the hospital management information system by CDAC. The government is always very proactive, especially our health ministry, for digitization. So whether it is ORS, over here, the online registrations, you have even when the patients come over here, there's a scan and share, the QR code is also available. We have the digitization of our entire medical record starting from 2012. So we are moving gradually into it. And I'm sure that whatever has been envisioned by the Ministry for the digitization, we will achieve and become a model for the same. Yeah.
So also you touched upon the research. So what steps are taken in regards to the research and development? And are you exploring any niche areas like biotech sciences or pharmaceutical sciences?
Very important case. I think, as I said, one of the most important mandates for our AIIMS, of course, is teaching, training, one aspect, research and patient care. So one of the three important pillars, research is a very important pillar. And we do have for the MDMS, we have the thesis, which is compulsory, or for the postgraduates who are doing their DMMCH. And the faculty members have to do research, otherwise their career progression is directly dependent on that if they have to progress further. And we always encourage them. There are funds which are available. There are intramural grants of up to ₹5 lakhs which are given to every faculty member who joins. Even students are also encouraged and taught about research methodology to even at the graduate level, that is the undergraduate level, MBBS level also, apart from the PG level. So all these initiatives will help us to understand the importance of research. Everybody gets an orientation and subsequently further detailed training on research methodology, which is very important for everybody, whether they are students or whether they are faculty members. Biostatistics is also taught to them. And research which is focusing on important needs of the particular state. So in our state of Chhattisgarh, whether it is sickle cell anemia or cancers or road traffic accidents or malnutrition. So these are important areas where our faculty members are already doing good amount of research. And similarly, when we had COVID, we have seen a large number of COVID-associated mucormycosis, that is black fungus, which was called in the press and by the general public. So that we did a lot of research, and many publications are already now published in reputed journals or indexed journals. So we have to ensure that whatever research is done is then subsequently published in reputed journals. And we keep track of that also. And we have a separate dean, apart from dean academics and dean exams. We also have a dean and sub-dean, that is associate dean for research also. So they have a specific mandate to encourage and ensure and monitor the research quality.
So there's been a long pending demand, there's like implement of rotatory headship policy at the AIIMS. So what is your take on that? What is your opinion on that?
I think some of the institutions, other institutions have had it in the past. They are well-established institutions, and an expert committee is looking into this, I think, a rotatory headship issue. So I think a common decision will be taken by the experts, considering all the pros and cons. Some of the institutions are new institutions, but I'm sure the expert committee will come up with guidelines which will follow accordingly.
What are the long ignored healthcare issues and importance of basic public health and emergency preparedness? The pandemic has reminded us, because there's been a lot of learnings out of it. So what is the biggest lesson you have learned out of the pandemic?
I think I think you use the word very correctly, is preparedness. Now, preparedness is very important. One important aspect which one understood, even the well-developed nations had a problem. So it's not just the non-communicable diseases. We have this double whammy of communicable as well as non-communicable diseases. And because of this globalization and easy travel, diseases can spread far and wide in a very short time. So I think preparedness at all times, and to have setups which are modular, so you can convert your hospitals from, which were general hospitals to take up more serious cases or cases of a particular nature. We already have a proper separate trauma and emergency block. We are lucky in that sense, but a separate critical care block has also been approved for the new AIIMS, including our institution, and we'll be taking that forward. But I think it's the preparedness and the training. So in many places, they had the hospitals, but the fact maybe the nursing staff or the paramedics were not so much well trained. Our institution, apart from seeing patients, has helped the state to train their people, whether they were the medics, the paramedics, the nursing staff, technicians, how to use ventilators, how to take care of these critically sick patients. So that was one important thing. So to have the equipment in place and to have trained personnel to utilize this equipment. Another thing which was very important was we have a very important lab here established by the ICMR, the viral diseases lab for research. And that particular lab played an important role in setting up these kinds of virology labs so that RT-PCR tests could be done in different hospitals of the state of not only Chhattisgarh, but Jharkhand also. So I think that's important to have trained manpower and place that manpower not just in one or two places. They should be available across the country in a distribution, because our patients will be everywhere. But institutions like ours will have a role not just for patient care, but for teaching, training, and overall impact should be much larger, because we'll be able to train so many people. And I feel that apart from doctors, the training of nurses, the training of technicians, and the allied healthcare staff is going to be very important.
How different it is when other AIIMS centers, how different it is, how unique it is, what kind of things which are you're seeing, which is unique only for cases which comes in, right? And how do you tackle these challenges?
I think one of the important ones, like you had mentioned, is the huge tribal population. So there are certain diseases, for example, which are more common in a tribal population. Maybe there are tribal populations in other states as well, maybe in Northeast or different, even Jharkhand, for example. But what we see is, they have their different diets. It could be, malnutrition, or it could be sickle cell disease. And there you have to understand the nature of the food, their practices, and treatment should be given accordingly for that. I think that's one aspect we noted. And the other thing which I feel is very important is, again, important for public health, is the use of gudaku and tobacco chewing, because of which oral cancers, mouth cancer, tongue cancer, buccal mucosa, cheek cancers are quite common over here, and children start it at early age. So I think that health awareness should be there, that avoid all this so that you will have a much better and healthy life. So I think these two aspects are very important, I felt, which were more unique, maybe existing in other areas also, but something which needs to be really tackled over here in our state. So one is malnutrition, especially for those who will not be able to afford, and sickle cell disease, more so in the tribal population. And number two, as I mentioned, avoidable thing is avoiding use of chewable tobacco or gudaku or whatever tobacco that you call over here. And that will certainly cut down the number of oral cancer cases that we see.